We complete thousands of individual movements throughout each day. Most of these movements are by choice and well planned out by our nervous system. They require a great deal of coordination between various muscle groups in order for the movement to be successful. Hidden within these voluntary movements are complex interactions between the joint surfaces of each bone. We refer to these additional joint motions as arthrokinematic motions. Let's take a closer look at movement and how it happens. Movement occurs at a joint between two bony segments. Motion between those bony segments is referred to as osteokinematic motion. The motion occurring at the joint surfaces we call arthrokinematic motion. Motion at the glenohumeral joint occurs between the humerus and the scapula. We call this osteokinematic motion. There are other motions that can occur between the joint surfaces of each of these bones. Let's review the other kinds of motions that can happen between the head of the humerus and the glenoid fossa of the scapula. There are 5 different types of arthrokinematic motions that can occur at a joint surface. We can have gliding or sliding, rolling, spinning, compression between the joint surfaces, or traction between the joint surfaces. It's important to note that arthrokinematic motions are involuntary, whereas our osteokinematic motions are done by choice. If normal arthrokinematic motion is impaired, the overall ability to move at a joint can be affected. With gliding or sliding, there is linear movement of one joint surface on the other. In this case, there is one point of contact on the ball that glides over several points of contact on the surface. Rolling is an angular motion. As rolling occurs, each subsequent point of contact on one surface contacts a new point on the other surface. Spinning is a rotary motion. With spinning, one point of contact on one surface remains in constant contact with one point on the other surface. With compression, our joint surfaces are forced closer together, a term which we refer to as approximation. With traction or distraction, our joint surfaces are pulled apart, reducing the amount of contact between the joint surfaces. It's important to realize that more than one arthrokinematic motion can occur at the same time. Which motions occur is dependent on the bony architecture of the joint and the muscle activity surrounding that joint during a particular movement. To better understand how these motions occur at the same time, let's return to our shoulder example from earlier. Let's look more specifically at shoulder abduction. During this motion, our arm moves upward. If we simply had rolling occurring at the glenohumeral joint, as our arm moved upward into abduction, the head of the humerus would bump into the top of the scapula. If we simply relied on sliding or gliding, we would not have the elevation of the humerus that we're hoping for during our abduction movement. So we need both rolling and gliding to happen at the same time. This allows the head of the humerus to move and maintain its proper position in the socket as our arm abducts. So to review, we learned about 5 different arthrokinematic motions, including gliding or sliding, rolling, spinning, compression, and traction. They usually occur in combination and are an important part of normal osteokinematic function. So hopefully now you can appreciate that rolling, spinning, and gliding are an important part of how our body functions.